chose to write a novel because I believe that fiction's a place where we can work things out and no one gets hurt, especially in politics. There's plenty of books out there by politicians and medical professionals about the policy implications of one healthcare system or statistics from another country, and I didn't want to do that. I wanted to write a very realistic scenario, something that could happen to any one of us here in America that's thinking about the healthcare debate right now. So I have a young family, husband and wife, both with great jobs. They have a young son that's the star of the local Little League team. And when that son collapses on the baseball field, they take him to the hospital, and they find themselves enmeshed in the system that's called universal coverage. And this is the system that they rallied for when they were college students. And it soon becomes a question of be careful what you wish for, you might get it. Of course, some of the well-known political books that affected me are things like George Orwell's 1984 or Ayn Rand's Atlas Shrugged. But there's another book that I read years ago that had a profound effect on my writing, and that's John Steinbeck's The Moon is Down. Steinbeck wrote The Moon is Down in 1942, and it's the story of a small town in Northern Europe that's overrun by an invading army that subsequently occupies the town. What Steinbeck did brilliantly in the book was to show both sides of the story. There are good guys and there's bad guys, but they're all human. They all have their motivations. And that's what I wanted to do in universal coverage. I wanted to show both sides of the healthcare issue, but from the perspective of a guy stuck in the middle. I think that's where things get very interesting, where a guy has to decide between what he'd like to do and what he has to do. I travel extensively outside the United States, and what I've found in Europe and the Caribbean, for example, is that there are two parallel healthcare systems. You'll have the government-run option, which is available to all citizens, and then you'll have private clinics, which operate on a more cash-and-carry type of basis. I wanted to bring both of those elements together in universal coverage. And the way that I did that was, there is a government-run plan that covers all Americans, and then there's a cruise ship off the coast of Cape May, New Jersey that's been converted into a floating hospital. And the dilemma for Bob Smith, the lead character, is, does he wait for the government system to kick in and give him what his son needs, or does he go out to the cruise ship and get it right away?